Hello and welcome back to IVF Daddies. I am today incredibly lucky because first of all, I'm in Los Angeles. And secondly, I am with a doctor that has popped up many times whenever I'm watching TV. And that's because he's one of the top doctors here in LA and has helped many famous people. And one of the things I want to talk to Dr. Andy Huang about, hello.
Hi. Thanks for having me, Richard.
One of the things I want to talk to you about is a bit of this myth around people don't want to lose their figure, they go for a surrogate, or they want to just not carry a baby. And I think that's one thing I'd like to talk about. And then the second thing I'd like to talk about is how on earth do you keep it a secret? Like, I watched one of the reality TV shows where nobody knew that she was doing this, was pregnant. Even her mum didn't find out until she got shown a baby. I'm like, how? This is LA. Like, every time you walk around the corner, there's a paparazzo.
Let's talk about the first question.
Yes.
Because the first question was the myth.
Yeah.
That celebrities or not, that women come here, want to have a baby, and they don't want to jeopardize their figure and their
career.
Their career.
Yeah.
Right. And I can tell you that's a big myth. Because the vast majority of women who go through fertility truly want to cherish the maternal journey of being pregnant and delivering a baby. The vast majority. When people come in and we find out that they need a surrogate, it's hard for them to bring that up. Yes, there are some elective surrogacies that people utilize, sometimes for very legitimate medical reasons, but sometimes because they've heard stories and they're worried about kind of the pregnancy, the dangers of pregnancy, not just to their health, but to the baby's health. As doctors, we spend a lot of time demystifying that and saying we're in a country that has great healthcare, that has great kind of obstetrical, prenatal, and postnatal care that allows us to monitor very closely. So the risks of pregnancy, albeit it's not no risk. Once we convey that to the patients, oftentimes they do want to carry. When they don't want to carry, then that's where we have the options of using a gestational carrier. Because somebody who's never carried, I don't know if that first pregnancy is going to bear the risk of premature labor and a premature baby because they've never been pregnant before. And they can have complications in pregnancy, high blood pressure, diabetes that bear risk to the mom and the child and the pregnancy. Whereas if we use a gestational carrier, that gestational carrier has already had 2 kids, 3 kids. So we know that for the most part, they have a really good track record. And so it gets us from point A of achieving a pregnancy to point B of delivering a baby to the highest success possible.
So would you say that the majority of people that come to you have been trying and they can't, and then you sit there and go, okay, this is why, and then these are the options, and
absolutely, yeah.
Not they come to you going, I don't want to do it.
Absolutely, the vast majority. Those that come in, they don't want to, that might be a small 1 or 2%. So the vast majority that we're taking care of are your neighbors, that are your colleagues that have had a hard time getting pregnant. We got to figure out what's the reason for them.
And of course, I would assume that the gay guys coming in, right. As much as I'm gay, as much as I tried to get pregnant, it never happened. I needed a surrogate. Yeah. So that's a natural that you have no choice.
Yep.
Right?
You got it. Because any pregnancy needs 3 things, right? We need sperm, which we have plenty of. We need an egg, which we use an egg donor. So we get young eggs for that. And we need a uterus. And if we can achieve those 3 things, we have high probabilities of successfully achieving a pregnancy and a family.
Amazing. So then moving into the second part, how do you keep it confidential, secret, NDAs, how does that all work?
So the funny thing is that, I am notorious for, if you talk to my nurses and they will come to me and say, that's so-and-so, or you just said so-and-so. For better or for worse, I do not have that recognition of who is who. So everybody's treated the same here until somebody says, yes, there's privacy risks at stake. This person's going to bring a lot of attention. And in those circumstances, we'll go above and beyond. Now, again, we treat everybody the same. Here, we have very strict privacy rules so that anything in the office stays in the office. We have a rather large waiting room so that people can stay in their own corners. But for somebody who's, look, I really want to be as private as possible, then we take it to another level. And the next level then is seeing them before the office starts. So if our office starts at 7:30, we'll come as early as needed to ensure privacy. So in the rare circumstance that some patients, whether they are celebrity status or just don't want to bump into a colleague, we will make arrangements so they come in early or come in late.
Or come and sit in the VIP waiting room that
Yes,
we're in
that's right.
currently.
Yes, that's right. This room was made specifically for that, for those that just didn't want to sit in a waiting room and perhaps be recognized by others.
Yeah.
Yeah.
And I hear stories about having a VIP elevator and like car parks where people can like scooch in
Right.
Taylor Swift style to her concert, right?
Right.
Oh my God, have you done Taylor Swift? Starting a rumor. You've heard it here first, IVF daddies.
Yeah, no, we're in this big building, so we have underground parking, and we've been in this location just this year, but we've always tried to have locations where there's underground parking so that somebody can't follow you. You go down to the parking. We have elevators that aren't specifically private elevators, but in certain circumstances, we will have somebody on standby waiting to receive somebody and escorting in as private as possible fashion. And then we use the back door if we need to, so that nobody's recognized as they come in. We do everything we can. For the most part, everything works, but we do want to have that highest level of discretion for those patients.
But it's nobody's business
It's
at the end
nobody's
of the day,
business.
is it? It's them. They're going, anybody walking into a fertility clinic doesn't want to be there, realistic. That's a challenge to begin with. And then having additional challenges of people saying, hey, oh my God, it's you.
When it's interesting, it's not necessarily celebrities sometimes that come in. It's coworkers that come in and sometimes bump into each other, or a friend that bumps into each other. And when that happens, I'm always like aghast, and I'm like, I'm so sorry. We do our best to really be discreet. And when that happens, I get one of two responses. One response is, oh my God, it's okay, because we're going to be very discreet between the two of us. And it's nice to know that they're going through it.
And I can actually reach out to them and talk to them about it now. Yeah. I'd never thought of that.
So I do get that response.
That's a good one.
Which I'm very happy about when I get that response. Then I get the response sometimes, oh, that's my boss, and I didn't want them to know. We do our due diligence and they're not everybody's in the waiting room at the same time. Once they get in the office, again, we have this private kind of rooms like this that patients can stay until they're called. Once they're seen, we have enough kind of room so that we can quickly take patients from the ultrasound room to a teaching area so that it's one-on-one with the nurses.
Right.
Yeah. But again, so we do our due diligence as most people do. So this is not something we do uniquely, that here we're always prioritizing confidentiality and privacy.
Yeah. But I think it's really important to hear that the people that are going through this are not doing it out of choice, that they just like, my career is coming first. Or the majority of people coming through here are because they just want a family.
Yes. The vast majority, Richard. People are coming here are truly, they want to start their family. They would like to carry and go through the motherhood journey themselves, but sometimes just cannot.
And here you are to help them.
Yes.
You're the best. And this has been an honor. Literally, I've seen you on TV, I've seen you on the reality TV shows, and like Julio's was like, oh my God. And so when I told him that I was coming here today, he nearly, he shrieked.
Yeah. It's an honor to be here. So I feel equally honored to be here today.
Thank you very much.
Okay.